Hi everyone. Today we are started new unit 5, blood products and plasma substitutes. Now we will start blood specimen collection and processing. The first step in acquiring a quality lab test result for any patient is the specimen collection procedure. The venipuncture procedure is complex, requiring both knowledge and skill to perform. Several essential steps are required for every successful collection procedure. Before we are starting the procedures, first of all, we should know who is phlebotomists. Phlebotomists are people trained to draw blood from the patient, mostly from veins. So they are taken mostly from the veins for clinical or medical testing and blood transfusions and donations or research oriented labs. Phlebotomists collected blood primarily by performing venu punctures or for collection of minute quantities of blood finger sticks. So these peoples are called phlebotomists. The first procedure is venipuncture procedure. A phlebotomist must have professional, courteous and understanding manner in all contact with all patients. The first step to the collection is to positively identify the patient by two forms of identification. Ask the patients to spell his or her name and take his or birth date. Check this against the requisition. Check the requisition form for requested tests, other patients' information and any special draw requirements. Gather the tubes and supplies that you will need for the draw. Position the patient in a chair or sitting. Next, wash your hands. Next, select a suitable site for venipuncture by placing the tourniquet 3 to 4 inches above the selected puncture site on the patient. See below for venipuncture site selection. Some notes are given here that are: do not put the tourniquet on too tightly or leave it on the patient longer than 1 minute. Next, put on non-latex gloves and palpate for a vein. When a vein is selected, cleanse the area in a circular motion, beginning at the site and working outward. Allow the area to air dry. After the area is cleansed, it should not be touched or palpated again. If you find it necessary to re-evaluate the site by palpation, the area needs to be re-cleansed before the venipuncture is performed. Ask the patient to make first, avoid pumping the first. Grasp the patient's arm firmly using your thumb to draw the skin taut and anchor. Swiftly insert the needle through the skin into the lumen of the vein. The needles should form a 15 degrees angle with the arm surface. Avoid excess probing. When the last tube is filling, remove the tourniquet. Next, remove the needle from the patient's arm using swift backward motion. Place gauge immediately on the puncture site. Apply and hold adequate pressure to avoid formation of a hematoma. After holding pressure for 1 to 2 minutes, tape a fresh piece of gauze or band-aid to the puncture site. Dispose of contaminated materials or supplies in designated containers. Here I attached one video. This video will understood venipuncture procedure. Please go through this video.
Follow your local policy when performing this procedure. As venipuncture is an invasive procedure, infection is a risk, so it's performed by maintaining asepsis throughout. This involves identifying critical parts of the device that, if becoming contaminated, are most likely to cause infection. usually termed key parts. These key parts should be protected and not touched or come into contact with anything other than other key parts or key sites. The process of doing this is termed the non-touch technique. Confirm you've got the correct patient by checking the blood request form against the patient's ID band. Explain the procedure and gain consent to perform it. Venipuncture is usually performed in the larger, straighter veins in the antecubital fossa. Blood should not be taken from an arm where IV fluids are running, as this will dilute your blood sample and produce inaccurate lab results. You should also check for other relative and absolute contraindications to performing this procedure. In the preparation area, gather the equipment. You'll need a trolley, a tray, something to clean them with, a needle system, blood sample bottles of the appropriate type, something to clean the skin with, gauze, disposable tourniquet, a sharps bin, an apron, a pair of non-sterile disposable gloves, hazard bags and blood request forms. Wash your hands with soap and water using the 7-step process and then put on an apron. Clean both your trolley and the tray thoroughly with an appropriate wipe, or if they're visibly dirty, use detergent and water first. As you've been cleaning, wash your hands. Open the equipment into the tray, taking care to ensure that any key parts do not get contaminated. Pre-vacuum your sample bottles by pulling back on the plunger until it clicks and then breaking the end off. Since you've been walking through doors, touching things which are potentially contaminated, wash your hands. Apply the tourniquet about a hand's breadth above the proposed puncture site. Select a nice, visible, bouncy vein. Release the tourniquet for the patient's comfort and to prevent damage to the blood cells. Wash your hands and put on your gloves. Reapply the tourniquet. Clean the site vigorously using a crosshatch motion for 30 seconds and then leave it to dry for a further 30 seconds. During this time, remove the protective cover from the needle. Remember, you've exposed a key part. Tethering the skin with your non-dominant hand will help stop the vein from moving around. And then place the needle tip at the proposed puncture site at an angle of around 30 degrees to the skin with the bevel facing upwards. Warn the patient, then advance the needle so that it pierces the skin and enters the vein. With some systems you'll see a flashback of blood to show that you're in the vein. Hold the needle steady as movement will cause pain, and then push each sample bottle into the holder. Since you vacuumed the bottle, the blood will be sucked into it. Once it's full, remove the sample bottle and invert it several times to mix it. The process can be repeated for as many sample bottles as you need. There will be an order of drawing which the bottles should be filled, which you should be aware of. Once you've filled your last sample bottle, release the tourniquet and place some gauze over the puncture site, but don't put pressure on it yet. Remove the needle and only then press down with the gauze. Activate any sharp safety system before placing the needle straight in the sharps bin. In most cases, applying pressure for about 5 minutes will prevent a hematoma from forming. Filling in the patient's details at the bedside will reduce the chance of any error being made. Then, place the sample bottles in a hazards bag along with the request form. Clean up after yourself and wash your hands.
The second procedure is finger stick procedure. The best locations for finger sticks are the third middle finger and fourth ring fingers of the non-dominant hand. Do not use the tip of the finger or the center of the finger. Avoid the side of the finger where there is a less soft tissue, where vessels and nerves are located, and where the bone is closer to the surface. The second finger, called index finger, tends to have thicker, calloused skin. The fifth finger tends to have less soft tissue overlaying the bone. Avoid puncturing a finger that is cold or cyanotic, swollen, and scarred or covered with a rash. When the site is selected, put on gloves and cleanse the selected puncture area. Massage the finger toward the selected site prior to the puncture. Using a sterile safety lancet, make a skin puncture just off the center of the finger pad. The puncture should be made perpendicular to the ribs of the fingerprint so that the drop of blood does not run down the ribs. Wipe away the first drop of blood, which tends to contain excess tissue fluid. Collect drops of blood into the collection tube or device by gentle pressure by the finger. Avoid excessive pressure or milking that may squeeze tissue fluid into the blood drop. Cap, rotate and invert the collection device to mix the blood collected. Have the patient hold a small gauge pad over the puncture site for a few minutes to stop the bleeding. Dispose of contaminated materials or supplies in designated containers. Label all appropriate tubes at the patient beside.